My name is Dr. Teresa York, and I'm a pediatric hematologist oncologist. I've been doing this for about 10 years. I am right now currently the interim division head of our department, and what that entails is taking care of birth to age 21, anyone with a blood disorder or cancer. We give chemotherapy. We do all of our procedures are done with sedation with our pediatric anesthesia group. Some of our tumors need radiation oncology, so we use the radiation oncology here, as well as all of the pharmacy, everything that we have here in this hospital, we do for children with cancer. It's all types of cancer. We don't have, some institutions have doctors that just do a certain type of cancer, but we actually see all types here. We have blood cancers, solid tumors, brain tumors, bone tumors, all the above. We treat all of them. So basically in our office, because we are a smaller group, we actually get to be very intimate with our families and really get to know them. We really want to treat the whole patient, and that's one of the things I find that is very unique about our program. We also have dedicated nurses and nurse practitioners who have been in this facility for almost 20 years and have never left their job. So you can see the joy that we take in taking care of our patients and really trying to do the best that we can to help them beat such a horrible disease, as well as our blood disorder patients like sickle cell disease who never get rid of their disease. They have to live with that forever, and just kind of helping them cope with what that means. So we really get to know these families and try to get treatments for them that we feel would be the best. I think what we offer here is we definitely have open ears. We actually listen to families, and really I think families appreciate that. I think when you're going through a stressful time, it's nice to know that someone else is listening to you. It's not just about me talking to you about the therapies. We discuss the therapy and then I get your feedback. And so I really try to take the time to do a lot of teaching and understanding about the process that they're about to undergo, as well as teaching and understanding of blood disorders that some patients don't grow out of. So we have both spectrums. We have chronic illness, and then we have illnesses such as cancer, which has a beginning and an end to treatment, but you deal with the effects of the therapy for the rest of your life. Actually, all of our treatments are based with the Children's Oncology group, so we don't have any treatments outside of that, but we do have some. We're looking into some other therapies to try to cope with the diagnosis of cancer, or how to cope with getting your port accessed. Those types of studies we're doing with our psychology personnel in our office, virtual reality study. So there are some outside studies, but none of them are treatment. They're actually supportive care and looking at the patient and how they cope with their illness, those sort of things. I would like them to know that we do treat 18 and up to 21. I do think that this is a population that, even though they're adult aged, I think they do better in our pediatric environment, just because they are still kids in my book. And we have data to show that they actually do better on our Children's Oncology group protocols. They do better with leukemia therapy, bone tumor therapy, brain tumor therapy. There are some instances when an older patient actually develops a pediatric cancer, and in those instances we are willing to share all of our information with the adult doctors, and that's what I enjoy about being in this hospital. I think that is a unique property about our hospital, is we are a children's hospital within an adult hospital, and we can offer those therapies to patients who may be over 18, so that they can have the best treatment possible.